Boom. Good morning, everybody. Welcome to Dental Voice with Zyris. My name is Rolando Mia. I have a special guest today. Her name is Cecilia Spellman. She's a registered dental hygienist in Santa Barbara. So when you look at it, Dental Voice is an opportunity for our guests to basically express their perspectives, share with us their opinions, and give us advice for people listening. If during the course of this session you have any questions or would like to, please go ahead and share them on the screen. And then depending on how and where we are, we'll go ahead and we'll answer those for you. So Cecilia, first of all, thank you so much for joining us. Good morning. How are you feeling?
Good morning, Ro. I feel great. I'll tell you what, it felt awesome to wake up and put makeup on and do my hair, put jeans on.
Wait. And they fit, right?
Oh my gosh, I actually could zip them up. It's a real thing.
So
I feel good. I feel really good. I feel grateful to be able to communicate with somebody other than my husband too.
does he know you? Well, don't worry about it. Only a bazillion people are listening to this, so he won't find out. So, so when you look at it, the purpose of this is to basically give you an opportunity to kind of share what you're experiencing right now. And when you think about dentistry as a profession, we've been hit, I mean, literally smacked upside the head with COVID and the whole quarantine. How are you? What's your experiencing with this, and how are you kind of dealing with that? And how's that experience for you?
Oh man. Initially, I think it was that Friday, March 13th, I got my first picture of the graph chart of who is most at risk. I know I'm sure you've probably seen them. And the top of that list on that Friday that I saw said registered dental hygienist. And of course, I went into work that Monday. We hadn't quite gone through that protocol of what was next. And I was in a sheer panic. And I didn't care what the doctor wanted or what the news wanted. I wanted to be home. There's a comfort in your house, your home, like being there, feeling safe. That was definitely my first initial reaction. I think I can speak on behalf of our entire nation. I have gone through every wave of emotion you can think of in the last almost 7 weeks. It's been very interesting, 6-7 weeks. But that hit me hard initially, without a doubt. A lot of fear. And I do have I don't know if you knew, but I have a genetic lung disorder. So that is something that it resonates very close to home with me. I do have to think about these things. And thankfully, the second I went in on Monday, my doctor had already started cancellations. He was very honest and he's also senior. And he said, if you don't mind helping me cancel a couple weeks worth of patients so we can try to figure things out, let's get us all home. And so that's where I've been.
Wow. You know what? It's interesting. I also have asthma, so I'm especially particular about that. So I can completely understand. When you look at hygiene and when you look at dentistry, it's now that we're quite a few weeks into this, there's a large body of information, and aerosols, the fact that this is transferred during the course of even people speaking is a big thing. How have you gotten over have you gotten over the fear or the anxiety of what's going on? How do you feel about it now?
Oh man. Well, it's interesting because, as a dental hygienist, we already are grossed out and I'm sure annoyed at all of the blood, spit, and pus that lands on our forehead. Let's be honest. Like, this is a no good, like, this is just disgusting zone. So I think going forward, my emotions of paranoia are certainly heightened. At this point, after being home and unemployed for so long, I'm anxious to see my patients. We build these relationships with people, all sorts, you name it, with our staff and our patients. And I miss that. I miss that relationship. I miss knowing how they're doing. I miss, I have a patient who's turning 100 in July, and she was inviting our office to go, and I don't think that's going to happen. So like, there's this anxiety about going back, and like a good anxious of wanting to see everyone and be around people and talk to people. But there's also a huge part of me that knows when I go back, it is not going to be the same. The protocols are going to have to change. And I think research and reading your part on the as much as you can without diving too deep in the internet, because the internet is like a really dark hole sometimes. But I've been really sticking with the CDHA, the ADA, and the CDC, which are all pretty much, on the same level, haven't changed much. And talking to my boss, that's been another one, my doctor. We've been in communication pretty much about once a week, so not too much. And it's been maybe like 30-minute conversations. He's reached out to me, I've reached out to him. And that gives me comfort. So with that anxiety, I've been able to find comfort in speaking and communicating with him, because no matter what, at the end of the day, when I walk into that office, it is his responsibility to make sure that we all feel safe, including our patients. So
That is
I'm
so
ready.
cool.
I'm
No,
ready when
that's
they're ready.
so cool. So you work at Mesa Dental in Santa Barbara, and that's owned by Dr. Walter Dukes. Is that correct?
Yes.
And that the practice has been around for quite a while, isn't it? So
Oh yeah, he built the entire building. May, I believe, yeah, May will be 32 years.
wow, that is
Mm-hmm.
awesome. What are
Yes.
you from an operational perspective, based on everything you've been talking about and what you've been learning, what are some of the things? Because right now that we're a good 7 weeks into the quarantine, we're
Mm-hmm.
starting to hear rumblings that the
Mm-hmm.
states are going to start loosening up and letting people start slowly get into back into the rhythm of working and all that. So what are some of the things that you're doing to kind of prepare you and your practice, or you personally, and then also your practice, to start seeing patients again?
Definitely being involved with the community and talking to people. A lot of emails. There's been a lot of emails. I am a part of a local component in town. As you know, it's called the Santa Barbara Dental Hygienists Association. I've been in communication with all of the women that I deal with through there, and hearing, I don't want to say gossip, but information about different practices and maybe some protocols that they're implementing that might not be what's recommended yet, but could be a good thing to implement into our practice. That's been one of the things we've been doing. I hate to say it, as far as like the ADA and the CDA and the CDHA, the recommendations for them hasn't changed too much, unfortunately, but I think that that's all in preparation, because we're not in California technically allowed to do anything but emergency appointments yet. But really, my doctor has been fantastic about looking into making sure collectively every week he's maxing out his orders. There's a limitation, obviously, what we can order, what we can access too. I do think, as far as accessing N95s, that needs to be priority for hospitals and people who are really dealing hands-on with it. So he's been able to access surgical level 3 masks. So he is getting full stock of those. We're getting the face shields. He's getting bulk as much as he can of the full gowns, making sure that we have proper evacuation systems, things that can help us, suctioning like the Isolite system, different things that we can use for vacuuming the air quality in the rooms too. So we've been really just trying to collect this stuff more than anything, so that when we are allowed to go in, we at least have the product to be able to help our patients.
That's great. So I love the preparation and all that. When you look at the organizations like the WHO, the CDC, when you look at the ADA, they're going to give guidance. At the end of the day, however, from what we understand, what I understand, you have a choice to do what you want to do. From that perspective, what specifically are you going to do in your practice, and why?
Oh man, myself personally. Now, this was a big thing my doctor and I actually talked about. He recognizes that there is going to be staff that is not going to come back. They're going to make that decision to not come. Just as patients are going to make that decision out of fear or worrisome, as they should, not to come too. People can play their precautions as they choose to, if that makes sense. Myself personally, surgical caps are a perfect example. I went on yesterday, as soon as my doctor said, he's hoping, there is no set date, but he's hoping in 5 weeks we'll be able to start seeing a more regularity of patients. I started looking into what the nurses and the staff is that they're wearing in the hospitals that I could wear. Remember, I'm at that 99.7% chance of contracting this virus. So however I can prevent myself from bringing it home, you should have your hair pulled back. So wearing a surgical cap that has a water resistant to it. I want to make sure to, like, my loops are a perfect example. There's a huge potential. I'm not going to be able to have my light on my loops. So getting those things ready for myself, not leaving my office with my scrubs on. That nobody's even mentioned that. Nobody's even discussed it to me, but it's gross enough as it is on a normal non-COVID day. So there is going to be a trash. We have washer and dryer. I know I have the abilities with the Lysol. There is a Lysol disinfecting detergent you could use for clothing specifically. So having that in the office and, leaving my scrubs and doing a load for the office in there, to have that there and not bring it home. That's my biggest concern, is just making sure that I can keep my home safe too.
That is cool. I love the precautions that you're thinking about. I also think it's so, like your scrubs you mentioned, getting covered with and having all that splatter on you from working on your patients. That's a
Mm-hmm.
great idea. From a organization, you mentioned that you're a member of, I think you're one of the public advocates for the Santa Barbara Dental Hygienists Association. First of all, I've had an opportunity to meet that team, the organization. They do wonderful CE. I really appreciate kind of the energy that everybody has and the cohesiveness. What is it? What's the dialogue, or kind of what's the discussion that you're having with your colleagues and other members of that team? What's kind of the overall feeling that you have about coming back?
I really haven't heard too much reserve from anyone. Everyone seems pretty anxious. I know, we live in a pretty expensive town. So everyone right now is kind of like, oh, I want money. Like, I need to make money. That no matter what, we love our patients. We hopefully love our bosses. We love our offices, but we do need money at the end of the day. So I think, collectively speaking with everyone, a lot of the people I do volunteer with, they all have families, they all have children. We do not have children. So they are enjoying every second they can of being with their children. I think it's amazing. I think it's great. I'm enjoying just having a break that I didn't even realize I needed. But collectively, that was one of the things that we had discussed, was wearing a face shield. Back in hygiene school, we had to wear face shields. We had to wear the bonnets across our heads, super attractive times. We had to do all of that stuff. So trying to find ways now to do it and make it more comfortable. That was a huge conversation we've been having just this week. There's been a lot of frustrations with some of the people that I've communicated to with about their offices saying stuff, opening earlier than, like, giving dates already, which we do not have dates. Our state does not have dates. So there's a lot of, I'm going to say, anger towards it too, and frustrations and fear because they're not. And I think that open line of communication with their boss, they need to have that in order to be able to feel comfortable going back, and maybe they don't have it. So trying to keep people more at ease, and that's mainly with the association of the girls that I do get to talk to. Really, we haven't gone much deeper than that. Everyone kind of knows just as much as I do.
Thank you for that. And I can imagine you're right, there hasn't been a definitive time, and you are hearing that some of these practices are actually setting dates. It's a two-part question. First of all, for the patients who might, happen to cross this video, or who happen to be listening right now, what's the message that you'd want to give across to them based on kind of your perspective, and to reassure them, or to help them kind of overcome some of this, I don't know if I want to come back. What would you like to tell them, patients?
Well, they need to have trust and faith in their practice just as much as I do, period. So if I'm going in there, you could go in there. That's kind of like, that, to be completely honest, if I didn't feel safe, I wouldn't. Like I said, I have a genetic lung disorder. I would not go in there if I didn't think it was safe for myself. You want to have that you want them to have that perception and visibly see that we are making those changes, not just walking in and it's a normal, regular day. Having them wait outside in the car That's a perfect example. You don't have to fill a waiting room. For heaven's sake, please don't. I was just in a doctor's appointment a couple weeks ago, and I had it booked for a year. So I was really hoping they weren't going to cancel on me, because that was not happening. So they had to see me, period. And it was a first thing in the morning appointment. And I went in, and another woman came in just about at the same time. And then a third woman came in, and the third woman came in, covered head to toe, was definitely more than just the N95 mask. And I understand there was, she was paranoid, but because the waiting room had 3 people, she went into a sheer panic. And that's what we need to avoid. We need people to not panic. So preventing that panic, making sure that you have, a different set protocol. Like, for instance, hi, I'm in the parking lot right now, and checking in, calling the front desk, letting them know, telling them, okay, it should be a couple more minutes. We will call you as soon as it is time for you to come in for your appointment. That's a perfect example. Allowing them to come in. Hand sanitizer. I know the country went a little crazy. I mean, between hand sanitizer and toilet paper, we had patients stealing our toilet paper. We did. It was crazy, because we keep it in like a basket in the bathroom. Anyways, but having that hand sanitizer,
don't mind me.
Oh my gosh, it was you. You were by, weren't you? But having, hand sanitizer, it's becoming more slowly readily available. I know it's still not that easy. Trust me, I have tried. But as it becomes available, even if it's that one bottle you can get when you're at CVS, start collecting things now, having it outside on a little table before they enter. Having it at the front desk, having it, having doors propped open, not closed, where you have to touch door handles, that visible viewing that kind of stuff from the patient is going to make them just as comfortable as it's going to make me comfortable at the end of the day. And seeing that we are doing all of the protocols, and that's what I want to achieve for them as well as myself.
Right. So it sounds like, make sure, or to patients who are considering going in, make sure they know that you've put things in place. First of all, I love this. Hey, if I'm willing to go in, you need to also be, because I'm not just exposed to one, I'm exposed to everybody. So that's a great message.
100%.
And yeah, I want to reassure you, I feel comfortable, you should. But in addition, establish clarity around, here are the things we're doing specifically so that you are safe. Did I get that? That's awesome.
100%. I couldn't stress it enough. I wouldn't go do something if I didn't feel safe. And that should go for every single person. And you should be able to feel comfortable with that thought process, period.
I love that. What advice, or, what advice would you give? It's clear, or at least based on what I'm seeing here, you have a wonderful relationship with Dr. Dukes, and you have the you've got the courage, I'll just say that, to say what you think when you think it. For other people who may not have that kind of courage, or are struggling with that, what advice would you give them with regard to how to communicate with their doctors, with their colleagues? These are not patients, these are colleagues who may not be in the same relationship you have. What advice would you give them?
I have always thought, so I've got a pretty broad experience in different offices. I originally worked in Florida at a practice, a couple different practices that I got to work at, and then I came out here. If you do not have a relationship with an office manager or your doctor in a way that you feel comfortable to be able to constructively speak with them, why are you there? That's just it. At the end of the day, you really need to value some form of a relationship. Now, on behalf of my practice, I am a team lead. I supervise the back of the house. I have had multiple accounts where people have come to me specifically, asked with frustrations, worry, or not understanding something, you name it. I've helped multiple people, everyone in the practice at some point or another. So having someone that you can designate to that and go to that person and be able to talk to them, I think it's really valuable. But if you don't have it, why would you? If you're spending so much time in another place other than your home with your family, and you're not getting that kind of relationship with people, it's a waste of your time. to be completely honest. And I'm very lucky. My doctor and I have very constructive conversations. He does come to me for advice. I come to him for advice. We communicate very openly, whether we agree or not. And we are very different people too. So, and it never gets heated. He takes everything I say into consideration, vice versa. So I think that if you are not a boisterous person, as I am, you need to clearly, you need to have someone as your voice and someone that you feel like you can go to and communicate with and tell them, like, I'm not comfortable with this, or better yet, instead of saying what you don't like, how about you come to somebody with an option, like, hey, do you think we could do this instead? Or have you seen the research on this device or this way to do something, to be able to make that better atmosphere for everyone? You need to have an advocate. You really do.
That is awesome. Thank you for that. And the sentiment around it, which is, hey, if this isn't where you are, why are you there? And
Yeah.
that's that really hit me hard, because why expose yourself, or why put yourself in a situation where you're miserable for that amount of time?
Oh,
I asked that because we had a guest on several weeks ago. Her name is Michelle Strange. She's also a registered dental hygienist and runs a podcast, Tale of Two Hygienists. She did a survey out there, and one of the results of the survey had this context around, she asked upwards of 700, I believe, hygienists, how they felt about what should be in place, and almost half felt that things could be better. It sounds like, from your perspective, you have an audience with your doctor, with Dr. Dukes at Mesa, to change those things. And I think that's really important. Do you agree with, well, I guess not agree, what are your thoughts on so many dental hygienists feeling that their offices need to upgrade, change, infection control protocols in their practice?
Oh man. Yeah. Well, I have definitely worked in some offices, I'll tell you what. I've seen some things. Well, it's so, and you're talking in regards to if they think there should be a change in their infection control in their office, right?
Yeah, it should be different, better.
Again, it goes to speaking up. So at the beginning of my career, I was very fortunate enough to be able to civilly work at an Air Force base in Florida, in Satellite Beach, Florida. And that protocol, there is no getting out of that box. You are set. There is a certain way you're supposed to do something or everything. And it is OSHA regulated to a T. And it gave me a huge perspective going out of how things were supposed to be. And I mean, I remember volunteering even at it was Southern Florida. It was like a community kind of health dental clinic, and people putting their hands in things with no gloves, and there's liquid, and things were being wiped down. And and that was a clinic on top of that. And you can't be in those environments. And if there are staff members that are not willing to do that, no matter how many times you throw that pair of gloves at them, again, why are they hired? Why are they here if they're not following protocol? Because at the end of the day, if OSHA comes in that door and they see that assistant or that doctor or that hygienist or that front desk person in the back, that fine is hefty per day. It's not excuse me, worth even risking something like that. I do think every office, let's be honest, I could say it, I'm sure, about my office. I could say it, I'm sure, about more than half of Santa Barbara offices do have things that need to be tweaked a bit. And as far as infection control goes, I think that this opportunity with the COVID, 19, is going to change offices a lot. I think those doctors and offices who are really set in their ways, who didn't want to, bag, instruments, for instance, or whatever, they're really going to have to change. And I think this is going to hopefully scare them enough to make them change. This also might potentially make OSHA go a little more, rampant. It might start circulating around a little bit more, potentially, just to avoid that spread. I think it needs to be important in a practice. And again, if you're working in a practice that doesn't value infection control, or there are staff members that don't value infection control, something as simple as just doing a lunch and learn with many groups who are willing to come in, or doing it on behalf of your own staff and just going over protocols, it needs to be done, period.
I love the message. If it isn't important, it needs to be important.
Yeah.
Make it important.
Mm-hmm.
Right on.
Yeah.
So with regard to infection control, aerosols are a big issue right now, and everybody's talking about aerosols and the fact that you need, constant hands-free evacuation with regard to that. Right now, there aren't, air filtration systems in the office, and what are your thoughts on aerosols, and how do you feel about the fact that they can potentially float in the air for hours and infiltrate and all that?
Oh man, I think it's disgusting. But we've always known that, now that this floating virus, it's not just like spit and blood that I'm concerned with. Now I have to know this virus is floating for hours on end. Products are going to come out that are going to help with stuff like that. I am, like, as you know, a huge fan of the Isolite system, especially when using the ultrasonic scaler to reduce that amount of aerosol and spray. I'm very lucky. My office I do have double doors that can open. So out to the beautiful ocean. So I do have that ability. We're going to have to come up with some kind of air circulation process, though. That's going to have to happen, I think, in order to make people more comfortable. The more, the better, I think, in my opinion. It's just kind of like your PPEs. It's not going to hurt to put on all this stuff. Is it going to suck? Yeah. Am I going to sweat to death? Probably. But, the more air circulation we can have, the better. So we're looking into different air circulations, as well as speaking, with our rep through Zyris about our Isolite products too, and trying to get as much as we can to get that crap out of there, get it filtered, get it out, so that I don't have to sit in there all day long, and just recycle one patient after another. Who knows what could come in there?
Awesome. Thank you for that. So from a hygiene perspective, how do you feel? Do you still, if you clearly, I get a sense that you love your profession.
I
Does
do.
it change your opinion about your chosen profession, given that there's this crazy thing going on right now?
Oh, it definitely doesn't change my opinion. I miss it. I do. I've had a couple moments where it's like, I'll be at the grocery store and, I'm fully covered with my mask, my 95 mask, and I see my patient, and it's like, I feel like it's not even a time for me to go and talk to them and say hi to them. Cause it's not like I can touch them on the shoulder, or I can take my mask off or anything like that. They might actually recognize me if they're only seeing me. But
Oh, Cecilia, hi.
They might actually recognize me, but I know I wouldn't change what I chose as a career. I would never change it. It's brought a lot of fulfillment for me and my, success. I've been very lucky in all the practices that I've been at, coming from Florida and coming to California. Santa Barbara has been very good to me. I have worked at a couple different offices, 3 different offices in town. I am at a home base with Dr. Dukes. I am full-time with him 5 days a week. And I miss it. I wouldn't change it for the world. And I look forward to going back, and I will put money on it. That first day back in the office, I'm going to be a mess. I'm going to be crying every second. Like, bring on the tissues. Like, it's going to be Jane Doe coming through the door. And I know it.
Oh, that is awesome. I love that. That is so cool.
Yeah.
So if you were to kind of sum up everything that we've been talking about, and you wanted to get a message out there regarding, what's happening, where we're going, what message would you like to give people, our listeners, people who will see this ongoing? What's kind of the closing thoughts that you'd like to give people?
What I just hope for people is I really want them to learn to be patient. This is a time for everyone. It's not just dental hygienists, it's everyone. We need to step back, we need to be patient, and we need to be kind. I know a lot of that not being patient can come with some aggression and anger, and anxiety, you name it. But if I could give any advice to people in general, my dental hygienists, my assistants, my people who are eager to go back to work, is to be patient and step back, enjoy the time that you can with your family. I hope that it's safe for people, because I know some homes aren't having a great time being home, but be patient and trust that our authorities are doing what they need to do in order for it to be a decent process going back to work, and stay active in the internet world of your community, talking to people, reaching out. Everyone's got access in their hand for the most part with their phone to be able to find information out. Be careful with your websites. It's like I said, I'm really staying on the ADA, the CDHA, the CDC. I'm staying very closely with those, because there's a lot of rubbish that comes through that is, shocking. I could go into work wearing a snorkel, whatever. But to be patient and be kind, and trust that our system is doing what they need to do, and do your research. And now's the perfect time to do some home continuing education, or learn a language. I know I have several Spanish speaking patients, there's so many things that we could be doing to help keep our minds going and stimulated, so that we don't have this almost culture shock going back to work, because it is going to be hard. And trust that the system is doing what they are doing for a reason, a good reason.
That is cool. That is awesome. I love that. If people had questions or wanted to reach out to you or ask you stuff, can they contact you? Would that be okay?
Yes, please, by all means. I hope I have answers. I can't promise anything.
What's the best?
Better yet too, if people just need to have conversation, I think that's important. So if people just need to talk to someone other than their family and about, dental, and they feel like they're just trapped in their four walls with their family who don't quite understand, and want a conversation, or they do have questions or maybe advice that I could possibly give, yes, they most certainly can reach me. My Facebook is Seci RDH. So it's SECI, separate word, RDH. My email is s.mesa, MESA, dentalsb@gmail.com.
Awesome. And I guess they can also reach out to the Santa Barbara Dental Hygienists Association too. And if from my experience, the members of the team have the same energy, the same passion. Yes. I don't know if they're as outgoing as you are, but you definitely express the love for their patients that you do. So I think that would be really cool.
Yes,
so,
and we do have a Facebook, cool. And it is attached to mine. So if anything, if you do feel like messaging the Santa Barbara Dental Hygienists Association, there is a couple of us who are attached to it. So one of us will get to the email, no problem.
Awesome. Well, thank you so much. Thank you for taking the time to spend with us this morning. Thank you for putting on your jeans.
Thank you for giving me a reason to do my hair. Yes,
Thank you for doing your hair.
On. I got nowhere to go now. I might go walk downstairs a little bit and take a walk to my garden with my coffee.
Your husband's gonna be like, "Where are you going?" I don't know. But the energy that you bring, your perspective is it's just so wonderful, and there's a positiveness that I think we definitely need at this time. I love the fact that you're very pragmatic and direct about things. A really strong message that came out is be direct, own what you want, and go there. So thank you for that. And
be nice, but be direct. It is so important. It is. Mm-hmm.
There you go. So. Those of you who are listening, if you have any questions, please feel free to reach out to Secilia. Thank you for joining us. If you like this content, please share it with other people. If you have any other questions, or you want us to ask our listeners and our guests, sorry, not our listeners, other questions, please let us know. Beyond that, thank you for spending the time. Please be safe. After this is all done and we're kind of past this, would you be open to joining us? I'd love to understand your experience after the fact. Would that be cool?
Yeah, by all means. I'd be curious to know too. So let's do it.
Well, have a great week. Please be safe, and thank you so much for your time.
Thanks, Ro. Good to see you. We'll see you soon.
All right.
Thanks. Bye.
Bye.